Hello guys, this is Dr. Dheeraj Masapu. I am an anesthesiologist specialized in neuroanesthesiology. Today I would like to discuss about airway management. So when it comes to airway management, it's a life and death situation for anesthesiologists. Everybody knows that you have to be a master in this. There are no excuses. So usually you have plan A, plan B and plan C. And also the best device, if you ask me, in any crisis situation, the answer would be an LMA or a substitute like an iGel or a Blockbuster, which is coming up recently. But if you ask me what device I use most commonly and more regularly is a bougie. So today I'm going to tell you the practical tips and tricks to use the bougie, and also where it will be useful and where you should not use it, and how many times should you use that is what I'm going to cover in this particular video. So when I started my anesthesia training, the practice was to use a stillet, and if you fail with stillet, then they would be giving bougie as a rescue device. But later on what happened is, in the evolution of anesthesia, the stillet has gone now and everybody is either directly intubating or they would take over bougie if they feel slightest difficulty is there. So that is how the practice is being done. So you can see in this article here, there are different grades of Cormac Lehan's views. It's called CL grading, you must be knowing by now. So in grade 1 you can see you can directly go for intubation without any kind of a bougie. Grade 2 also you can actually intubate, according to me, with directly, you can use the tube. But grade 2B is tough to directly intubate with the tube, so there I would suggest to go with the bougie's help. And coming to grade 3, again it is divided into grade 3A and 3B. You can see here. So grade 3A, see where you see epiglottis and some commissures you see, but you don't see the cords. So in that situation you can actually try once with bougie. Okay, in the end of the video I'll tell actually how many attempts you should give and what are the problems if you give multiple attempts. But in grade 3A you can give one attempt. Okay, and try sending the bougie, and how to confirm I'll tell you in the later part of the video. But grade 3B you can see here, I would not recommend using a bougie here. There you need to go for alternative plans like putting an intubating LMA and doing a fiber optic through that. Or if you don't have intubating LMA, you can actually put an LMA or iGel which have the access to put an endotracheal tube through that. Okay, iGel usually can be used, and Blockbuster LMS also can be used. So, and the next important trick is sometimes the bougie will enter but the tube will not thread. At that time, if you use your blunt force while sending the tube, there is always a possibility of damaging the cords. So what you need to do is you have to turn the tube in anti-clockwise direction. You can see in this particular image here. So here the tube is actually hitting the commissures. So if you turn the tube anti-clockwise, then the chances of threading the tube gets very higher. And the next important trick is using the click sound that you get. So what happens is, when you enter the vocal cords and enter the trachea, the shape of the bougie will be in such a way that it touches the anterior part of the trachea, and you can actually feel a click, or you can tell your colleague to keep your hand there and they can actually feel that bougie is going through that. And after that, when you thread the tube also, you can actually feel that it is going in right direction. In 3A situations where you actually can't see the entry of the bougie into the vocal cords, you can directly confirm in this way. It is beautifully given in this particular. So you can check out in this particular video. This is actually taken from YouTube. It is not my video. And see, you can send the bougie like that, and on top of that they would be threading the tube. And another important technique tip is that you can preload the tube before only. If you are intubating alone and if you don't have an assistance, then what you can do is you can preload the tube like how it is shown. You can preload it, and then there is something called as a kiwi grip. So this is called as a kiwi's grip, and then you can just send the bougie first. On top of that, the threading becomes very easy in this technique. There is something called as omega shaped epiglottis, where you see the epiglottis like this, omega shaped. So you don't have a clear cut view of the cords here. They will be seen in an angle like this. So in this particular angle, crossed angle. So in that particular situation, even though you call it a CL 2 view, but sending the tube is very tough because the angle is like this. In those situations, bougie will be very helpful. You can see. So first bougie has been sent and then the tube. So this is how the omega shape epiglottis situation can be dealt with the bougie easily. Yeah, there is some blood loss there. Usually it doesn't happen like that. But anyway, sometimes things are not in our control. It might happen also. So what are the different problems with the bougie? Number one is bleeding if the patient is on antiplatelets or anticoagulants, and sometimes the cardiac patients come. So in those kind of situations, there is a possibility of bleeding. So if the bleeding is little, then it will settle. If the bleeding is more and it is coming continuously, then what I would suggest is do a fiber optic and then see where the bleeding spotter is, and pass the tube distally to that so that the blood collects above that and it doesn't aspirate into the trachea, and over a period of time it will settle if the patient doesn't have a coagulation disorder. And the second thing is unable to thread. Sometimes none of the techniques will work. The bougie will go, but with all your strategies of anti-clockwise rotation and doing everything, still you will not be able to thread on top of the bougie. That time you don't try multiple attempts, you just come back and try to ventilate the patient. Always ventilation should be the first priority, not intubation. And the third thing is sometimes when you're doing in 3A view, the esophageal intubation also is possible with bougie. Multiple times it has happened. So you send the bougie, you'll be thinking that you actually threaded the tube, but it has gone into esophagus. Got it. So that kind of situation, what I would suggest is always keep an ETCO2 when you're intubating the patient. So if you are intubating in OT, obviously ETCO2 will be there in most of the centers. I don't know if your center is not having, then please suggest them to have an ETCO2. If the problem is when you're intubating in areas outside the OT, like an intensive care, an emergency, or a code blue intubation in a ward, when you're doing, try to carry a ETCO2 device. There are handheld ETCO2 devices also available. Just Google them and have a device before intubation. That is the only thing which will be going to save you, not your auscultation technique. What happens is in uncontrolled situations, when you're actually intubating the patient, there will be a lot of secretions in the form of lot of secretions can cause sound artifacts in auscultation, and also sometimes pulmonary edema if the patient is having, there will be a lot of artifacts. So with auscultation it is very tough to actually identify the esophageal intubation. The best way would be to use ETCO2. So bottom line is have ETCO2, have ETCO2, have ETCO2. And coming to the last and most important point, why actually I did this video is to tell you that you should only try once with a bougie. If you are not able to do that, don't try multiple attempts. Seriously, it is going to cause more harm. What happens is, after one attempt, if you are not getting, give it to your senior, let him try once and that's it. More than that you don't try. So what happens is, with every attempt, the edema will increase around the cords and spasm will happen. I don't have a clear explanation why spasm happens after the giving muscle relaxant, but things actually close there. So then what happens is the ventilation gets tougher by each attempt. So you might end up in a situation of can't intubate, can't ventilate situation, which is self-created by you. So always your priority should be ventilating the patient. Hope you understood what I'm trying to tell. So try once, otherwise the second attempt should be by your senior, not by you, and after that abandon with the procedure of intubation with bougie, put an IGL and just ventilate the patient. If you have a resource of fiber optic, give one more attempt with the fiber optic through the IGL. If you don't have, just wake up the patient and cancel the procedure. Got it? Because it is not worth trying multiple times just to prove your skill. Always try to be on the safer side in anesthesia. Anesthesia is more about safety than proving your skills to someone else. Hope you guys understood what I'm trying to tell. So think in these terms and you will understand what I'm telling. So that's it, guys. I think hope you understood how to use bougie and different ways and techniques and tips and tricks. And if you like the video, share it and subscribe to the video channel. So if you want to connect with me, Instagram is the location. Masapu Dheeraj is my Instagram ID. You can put a message. I would reply in that message. Thank you very much, guys, for following Dr. Dheeraj Masapu logging off Raj.com.